Head was here, feet was down here, sir.
Okay, so that would be to the far side of the bed?
Yes, sir.
Okay, and his...
Head where in the bed?
Head on the pillow, sir.
I'm sorry to interrupt. May the record reflect that there's distortion on the far right side of the photograph. Perhaps defense counsel could use the previously marked hard copy of the exhibit?
Well, whatever you can use, but because it does look a little weird on the right-hand side.
Just,
Oh, there it is.
because of that.
All right, thank you. It's been correct. Well,
Okay.
now it's back.
I can correct it. Give me a second. All right.
Please.
Okay, Mr. Seneff, you indicated that...
Blount.
Oh, Mr. Blount, Mr. Jackson's entire body was on the bed, correct?
Yes, sir.
Okay, and you testified that he had an IV attached to his leg?
Yes, sir.
Okay, and he also had a is it nasal cannula?
Cannula, sir.
Cannula?
Yes, sir.
Okay, and that was attached to his nose?
Yes, sir.
Which was then attached to an oxygen tank?
Yes, sir.
Okay, and you also indicated he had a condom catheter attached to him?
Yes, sir.
Okay, and all of that was in place when you first saw Mr. Jackson, correct?
Yes, sir.
Okay, and that would have been roughly about 12:26, 12:27 in the afternoon, correct?
Yes, sir.
Okay. Now, you described Mr. Jackson as being very pale and very thin, correct?
Yes, sir.
Okay. Now, do you recognize that black instrument on the bed? Do you know what that is?
No, sir.
Is that some kind of medical monitor or apparatus?
Objection calls for speculation.
Do you have any idea?
No, sir.
Sustain.
Okay, and when you first saw Dr. Murray, you said he was sweating profusely, correct?
Yes, sir.
Okay, he was frantic?
Yes, sir.
Okay. And as soon as he saw you guys, he's like, hey, please help, he's not breathing, right?
Yes, sir.
May
Okay.
we turn on the lights?
Yes, please. Thank you, Your Honor.
Thank you.
And then soon thereafter, I believe you testified that Mr. Jackson was moved to the floor, correct?
Yes, sir.
Okay, and who did that?
Part of my team, sir.
Part of your team?
Yes, sir.
Okay, and that would have been Mr. Goodwin?
Mr. Firefighter Paramedic Goodwin, Firefighter Heroin, and Mr. Murray, sir.
Okay, and Dr. Murray assisted him while doing that?
Yes, sir.
Okay, was there anybody else helping him?
No, sir.
Okay, so it was just them three who helped transfer Mr. Jackson from the bed to the ground, correct?
Yes, sir.
Okay. And then you indicated that there were certain questions asked of Dr. Murray, correct?
Yes, sir.
All right. And Dr. Murray responded that he was treating Mr. Jackson for dehydration and exhaustion, correct?
Yes, sir.
And that Dr. Murray was asked whether Mr. Jackson was on any recreational drugs, correct?
Yes, sir.
And he responded no.
Yes, sir.
Okay, and what are recreational drugs? What would be examples of some recreational
Illegal drugs, sir, like I guess heroin.
Or marijuana?
Yes, sir.
Cocaine?
Yes, sir.
Okay, and Dr. Murray responded no, correct?
Yes, sir.
All right. And then Dr. Murray was also asked if any other medication was administered to Mr. Jackson, correct?
Yes, sir.
And what was his response?
No.
Okay, and are you sure about that as you sit here today?
Yes, sir.
Okay, isn't it true that Dr. Murray did in fact tell Mr. Seneff that he had given Mr. Jackson lorazepam?
Did not hear that, sir.
Okay, so you didn't hear Dr. Murray tell Mr. Seneff that he had administered lorazepam, correct?
No, sir, I did not.
Okay, and did you hear Dr. Murray also tell Mr. Seneff that he had given the lorazepam to help Mr. Jackson sleep?
No, sir, I did not hear
Okay,
that.
so you didn't hear any. Okay.
I'm sorry.
No, sir, I did not hear that. Sorry.
Okay, and then you indicated that Dr. Murray was asked how long the patient had been down, correct?
Yes, sir.
And you previously testified that he said for about a minute?
Yes, sir.
Okay, isn't it true that Dr. Murray in fact said he's been down for about a minute prior to calling for help?
No, sir, I did not hear that.
Are you sure about that?
Yes, sir.
As sure as you are with the medication?
Yes, sir.
Okay. Now, at a certain point, you guys moved Mr. Jackson over to the foot of the bed to give you more room to work, correct?
Yes, sir.
Okay. And you guys start CPR?
Yes, sir.
Okay. And I believe you indicated that you were in charge of the ventilation and giving breath to Mr. Jackson, correct?
Yes, sir.
And was it Mr. Heron was in charge of the compressions?
Yes, sir.
Okay. And did I hear correctly earlier when you testified that the breathing is the most important aspect of CPR? Did you say that?
Yes, sir.
Okay. Isn't it true that recently the guidelines have changed by the American Heart Association and now compressions are the most important thing?
Yes, sir.
Okay, so it's always compressions first, airway next, breathing last, correct?
Sir, and back in 2009, airway was first.
No, I understand, but now things have changed, correct?
Yes, sir.
Okay. And how many people were performing CPR on Dr. Murray?
My team consists of, it was 3 of us, sir.
Okay, and there was nothing unusual about that, correct?
No, sir.
Okay. And so if I were to tell you Dr. Murray had asked for assistance during CPR, that would be common, correct?
Yes, sir.
Okay. And you indicated that Mr. Jackson's skin was cool, correct, when you touched it?
Yes, sir.
And that his eyes were fixed and dilated, correct?
Yes, sir.
And you felt that to mean that he had been down for a while, correct?
Yes, sir.
Okay. At a certain point after administering CPR and administering the medication, atropine and
Atropine.
epinephrine, correct?
Yes, sir.
Mr. Seneff is in contact with the base station at UCLA, correct?
Yes, sir.
Okay, and at a certain point, UCLA tells you guys to just call it, correct?
Yes, sir.
And Dr. Murray didn't want to call it, correct?
Yes, sir.
Okay. He actually took over, correct?
Yes, sir. Took responsibility.
He wanted to continue trying to do what he can to bring life to Mr. Jackson, correct?
Yes, sir.
As well as you guys,
Yes,
correct? You testified earlier that you had noticed some lidocaine bottles.
Yes, sir.
Okay. And you showed us earlier that was right on the floor by the foot of the bed, correct?
Yes, sir.
Okay. It wasn't hidden, was it?
No, sir.
There was nothing covering it, was there?
No, sir.
Okay. Dr. Murray wasn't sitting on them, correct?
No, sir.
So they were out
Is that
there in
correct?
plain...
The double negatives are tricky. Could you re-ask the question, please?
Okay. Dr. Murray wasn't sitting on the bottles, correct?
Correct.
He wasn't concealing them in any manner.
No, he was not.
They were out in the open in plain sight, correct?
Correct.
Now, the prosecutor asked you whether Dr. Murray ever mentioned Propofol. Is that correct?
Correct.
Okay. Now, at this point in time, Mr. Jackson was in PEA mode, correct?
No, sir.
What was he?
He was in asystole the whole time, sir.
Okay, so as you sit here today, you don't even recall Mr. Jackson being in PEA?
No, I do not recall that.
Do you know what PEA stands for?
Yes, sir.
Okay. Is that pulseless electrical activity? Okay.
Yes, sir.
And Mr. Jackson, according to your testimony, was never in PEA, correct?
Correct.
Okay. Thank you very much, Your Honor. Nothing further.
Mr. Gorgian, thank you. Ms. Brazil, redirect exam. You need a moment? Thank you.
Nothing, thank you, Your Honor. No further questions.
Thank you. May firefighter Blount step down subject to recall? Ms. Brazil? Excuse subject to recall?
Yes, thank you, Your Honor.
Mr. Gorgian?
Yes, Your Honor. Thank you.
Firefighter Blount, thank you for your testimony, sir. Please do not discuss your testimony or the facts of the case with any other witnesses until we finish the trial. And while you may step down and leave, you are to remain on call, and that means you're subject to recall until the end of the trial if necessary. Is that acceptable?
Yes, sir.
Thank you.
Thank you.
You're welcome.